My name is Dr. Sophia Deben. I am a Miami native, kind of rare. Born and raised here, went to Coral Gables High School. I trained at George Washington University for medical school and took a military scholarship. So I served active duty with the United States Navy for 7 years, deployed forward to Iraq, and then worked quite extensively with limb salvage patients who were trying to avoid amputation as well as developing better prostheses for amputee patients. I completed a fellowship in foot and ankle surgery, and I work quite a bit with athletes here in South Florida. We have a very large tennis community and a very large triathlon community with quite a bit of swimmers, runners, cyclists, obviously tourists coming in and out of South Florida who like to rent mopeds. My practice right now is a bit of a mix, which is really great for me. I see acute trauma, so patients that have brand new fractures, most of them thankfully can be treated without surgery, and then the ones that do to include knee, hip, and ankle, as well as complicated foot fractures, as well as sporting injuries, and so ankle sprains, Achilles tendon tears, things that pretty much anyone will have. I really focus on non-operative care. I really try and keep people out of the operating room. I really try and implement as many non-operative modalities at the same time. I try and focus on improving pain and inflammation, and then I focus on range of motion, and then I focus on functional rehab, getting them back to whatever their sport or their work activity is. I really like to use photomodulation, stem cell or PRP injections depending on the patient's level of activity and their age. And I really try and engage patients in their own care. I encourage them to take notes, I encourage them to keep copies of their notes, and I encourage them to every day push themselves a little further than the day before. I've really switched over to minimally invasive surgical treatments. I do quite a bit with patients after surgery in terms of massage and desensitization of the nerves about the foot and the ankle, and really encourage folks to do level, limp-free walking. And so many times in clinic, we will actually walk together and go over their physical therapy exercises so that I can verify that the activities that they're participating in therapy and at home are actually the correct ones to recover from their injury. Usually I rehab patients within 3 to 6 months and get them back to their activity level. And obviously with patients who have more severe injuries, specifically crush injuries or dislocations, I also like to be forthright with them at the beginning and say, look, we can make you better, but your foot, your ankle, your knee, it's never going to be exactly the same. I feel that the less patients are surprised and the more information they have, the better they are at engaging in their own care and being a little bit more self-motivated. I really try and bring in whatever social support they have and encourage their partners or children, their parents, whoever happens to be involved in their care, to know what they should and shouldn't be doing so that they can have some secondary feedback and some community support. I see patients both in North Miami off of 123rd Street near Ball Harbor, as well as in South Miami off of Bird Road near Tropical Park. The best way to get a hold of us is 786-923-3000. That's the telephone. You can also reach out to the office, info@iorthodox.com. If you need to reach me directly, dr.deben@iorthodox.com. We also have our website, www.iorthodox.com.